Hello, ma. How do we know when we are fertile to get pregnant? Hi, you are watching Tochi Fertility Channel. If it is your first time and you like what you are watching, please like and follow. Before I proceed to this video, I want to put a disclaimer that I am not a professional. I am not a medical practitioner. I am a good researcher who study a lot. When I study, I try to impart this knowledge on my fellow women who are trying to conceive. So, on this note, if you have any issue with your health, your fertility, please endeavor to visit your gynecology, your healthcare provider. Let them conduct proper tests on you. Like you heard me say from the beginning, somebody is asking that I should enlighten, I should educate them on how to know is ready for conception. And I strongly believe that the person who asked this question is my new follower. That is why I am always pleased to repeat my videos, because a lot of people are following me. And this question is very, very important, because if you don't know this, it will be very difficult for you to become pregnant. So pay attention. Sometimes when people ask questions, don't blame them. They are asking because they don't know. So how do you know when your body is ready for conception? Now, most fertile days in your cycle are the days leading up to ovulation before the egg is released from the ovary. This is also referred as fertile window. Have you heard about fertile windows? Have you heard about that? Fertile windows are the days that is leading to your ovulation. They are the days that will come before your ovulation. And what is ovulation? Ovulation is the day that a matured egg is released from your ovaries. So your fertile days start 5 days to ovulation day, which will complete in 6 days. Let me use, for example, if you have 28 days cycle, which means your fertile days start from cycle day 10, 11, 12, 13, 14. So these are your fertile days. And it's very, very important for you to baby dance, for you to make out with your partner on your fertile days. Reason being that the sperm can last in a woman's system between 3 to 5 days. The Y sperm lasts 3 days, while the X sperm can last for 5 days. And the reason, another important of baby dancing during your fertile window is this: some of us, our husband semen, have problem of motility. So if you baby dance on these days, these semen will have more opportunity, more time to travel, so that immediately when the egg is released, they will fertilize it instead of the egg coming and be waiting. And remember, the egg lasts only for 24 hours. 24 hours, if nothing is there to fertilize the egg will disintegrate and shed its lining. So baby dancing, understanding your fertile windows, your fertile days, and the most fertile days is very, very important. Your fertile days are the days that leads to your ovulation. Why the most fertile days in your cycle? Why the most fertile day in your cycle is the ovulation day, which is the D-day. I don't know if somebody gets me. I don't know if I'm making sense. I will repeat myself. Somebody said, how do they know when they are fertile to become pregnant? And this will also drag me to the signs of ovulation. When your body is fertile, if you're a woman trying to conceive, you must pay attention to your system. Whatever goes on in your system gives you signs. But because of ignorance and not paying attention to your body, you wouldn't even know. Some of the issues that women suffer from, it gives them time. But because, would I say, they are not paying attention, that is why they don't understand when it happens to them. For example, if you are a fertile woman, if you are fertile, during your fertile window, you will see cervical mucus changes. You will see cervical mucus that is drawing, sticky, like egg white, most of you call it. That fertile fluid is telling you, oh, my dear, I am ready. Your body is ready. Your body is asking you to put something there. Some people during this period, you will have craving for food. You have breast tenderness. You will have urge for baby dancing. Something that you are not doing before will start happening to you. But because we don't pay attention, you might even feel severe headache. This is telling you that something is about to happen. So there are many signs to look out for, but it needs a very attentive and calculative method for you to understand this. Some people will have a bit rise in their body bazaar. That is, your temperature will increase. How you will know that you ovulated? Your temperature will rise a bit and remain low until your next cycle. You will know that you ovulate and you have taken in. So fertile window is very, very important for you to know your cycle, for you to know your fertile window. This will help you to plan pregnancy. This will help you to achieve pregnancy without stress. But you're trying to conceive and you don't know anything about your cycle, about your fertile windows, it will be difficult for you. When somebody is talking about it, it will be like, I don't know, it will be like when a new baby is trying to monitor the environment. But if you study, go to search engine, ask your gynecologist or your physician or anybody that is enlightened about this to teach you how to calculate your cycle. Go to Facebook, YouTube, everywhere. People make video on how to calculate your cycle. You can even ask your medical practitioner. So window is very, very important to any trying to conceive mother. The next thing that can also help you to dictate this fertile window is what? Try out ovulation calculator. There is some apps that you can download in your phone that will help you to track your fertile windows. Like Flow, there is one called Flow. You can go to Apple Store, download them in your phone, chat it. They will ask you to register your 3 months cycle. You must know your cycle before you download this app. When you download the app, and they will ask you to download your last previous cycle. That is, they want to know how many days cycles you have. When you give them this detail, they will be able to use it to predict when you are likely fertile and when ovulation will occur. Then the next one, you can use OPK, Ovulation Prediction Kits. Ovulation Prediction Kit dictate what is called LH, luteinizing hormone. Luteinizing hormone is the hormone that triggers ovulation. After the FSH, then comes luteinizing hormone. So if you use this ovulation prediction kit to test, when you are approaching your fertile days, especially ovulation day, the control line and the test line will be clear. When they show you positive, which means you are about to ovulate. These are the things, but I would encourage everybody here to download that app called Flow or Ovulation Calculator. There are many of them. You can ask your gynecologist if they are the one that is very, very simple. They can calculate, but I think it might be a bit difficult for you to understand it. Then use this ovulation calculator. The next one is for you to take prenatal vitamins. Go to your gynecologist, go to your healthcare provider, go to a pharmacist. Don't buy any medication on your own. Don't buy any medication from unprofessional, but rather go to your physician. They are there for you. That is their work. That is what they are trained for. They know more about it. Another person can impart knowledge on you, just like the way I am doing, but you go to the people that knows this work very well. Every trying to conceive mother must start taking prenatal vitamins 3 months before you even start to plan. These vitamins will help to prepare your body. They will help you to carry healthy pregnancy. They will help in the brain development of your baby. They will help to prevent what is called tuber neural defect. This video is already long. I believe I have done justice to this video. If you didn't understand me, please rewatch it as many times as you can. Question you can ask your physician. Thank you so much for watching. I will put a disclaimer again that I am not a medical practitioner. I am not a professional. I am a researcher who study very hard, and I try to impart the knowledge on my fellow women. So if you have any question, issue, complaint regarding your health, regarding your fertility, endeavor to visit your gynecologist, your healthcare provider, and they will check you and provide a better solution to your problem. If you like what you just watched, like and follow our page, subscribe to this channel, share this video, and God will bless you. I love you.